Thank you very much for tuning in again. It's good to see you again. This is Dr. Michael Agron, your television doctor. Call me Dr. A, call me Doc, call me whatever you want. I want to thank you for tuning in. I've had so much response. I'm just delighted, surprised and delighted. And thank you again. And keep telling everybody about us and keep passing the word that I'm your free emergency room doctor, willing to help you with whatever I can, and you keep sending me your questions and your comments and your jokes, and we'll keep putting this on the air. I want to start with, I guess, a cliffhanger. I brought out something last time, and I said, do you know what this is? And I have passed this along to several people, even some doctors that don't know what this is. This is actually a chunk of dinosaur bone. And what you're seeing here with the smooth part is the joint. This is the surface where the bones come together. And then what really is the giveaway is if you look carefully right here, you can see bone marrow. And that's what really is the giveaway. So this is a broken piece of dinosaur bone. And I use this as a paperweight on my desk. Kind of an interesting paperweight, but I collect these kinds of things, and this thing is millions of years old. I think the dinosaurs disappeared about 65 million years ago, so this is an extremely old piece of petrified rock. So that's what the mystery was last time. I actually have something that I'm going to show you that I'll tell you about next time, and when you look at this, you may think you know what this is, but you may well be wrong. So I'm going to show this to you, and this is 2,000 years old. And if you look at this thing, you're going to say, I know what that is, and I know what that's used for, but you might well be wrong, and I'm going to tell you about it next time. One of the most serious and most common things that we deal with in the emergency room, one of the things that kill many people every year in the hospital or in the United States, are heart attacks. Now, what heart attacks are a blockage of the arteries that go around your heart, because they're feeding oxygen and sugar for energy to the muscles of the heart to make them contract. And when you come into the emergency room, we have a mandate that everybody gets an EKG within 10 minutes, because we need to know if you have a serious heart attack or not. Now, how do you know if you're having a heart attack? Well, you may be tipped off a little bit by your family history, because it is a bit hereditary, but not always hereditary. And so you can't just count on the fact that that's the tip-off. The typical thing that happens with a heart attack is that you develop chest pain. It's usually in the middle of your chest. It usually feels like an elephant is standing on your chest. And the pain may radiate to different parts of your body. It may go to your shoulder. It may go to your shoulder blade. It may go down your arm. It may go down both your arms. Actually, instead of just pain, sometimes people tell me they just feel tingling down their arms. The pain can go up to your neck. It can go up to your jaw. There are some people that have heart attacks that have no pain whatsoever, especially if you have certain illnesses like diabetes. Sometimes you will not have chest pain. There are other symptoms that go along with it: nausea, vomiting, sweating, profound weakness. There's a difference, actually, between men having heart attacks and women having heart attacks. Men usually get more of the typical things: the substernal chest pain, the pressure, the pain down the left arm. The women may get pain in other parts of their body, like their jaw or their back, and they may have only weakness, or they may have just sweats, or they may have nausea and vomiting and dizziness. So there is a difference between the men and women, generally speaking. Now, if you think there's any chance that you're having a heart attack, you need to get to the emergency room right away. It's a very dangerous thing, because what will happen is that your heart will have an irregular rhythm, and sometimes that rhythm can be fixed immediately by having you shocked with the pads that you see on TV all the time when you hear them saying, "Stand clear," bam. And that actually is a very effective way to get your heart back in synchrony again. So it's very, very important that you get into the emergency room whenever this happens. Too many people just say, oh, you know what, it's just heartburn, or you know what, it's just something else. You know, another tip-off sometimes is that your exercise tolerance will go down quite a bit. Instead of being able to walk 5 blocks before you have to sit down, you may walk one block, and that's all you can take before you have to sit down. So if you see that your exercise tolerance has dropped a lot, that can be a symptom that you're having heart disease. When we do the EKG and we see you're having a heart attack, or we suspect you're having a heart attack, we do blood tests that can also help us. And then if we've determined that you're having a heart attack, we send you down to the cath lab, where we actually can put a catheter right up into the coronary arteries, the arteries around the heart, and shoot in some dye and see where the blockage is. And then we go in either with a balloon, or if we can go in with a retriever, and we can pull out what's blocking the heart. It's usually a clot. And we pull out the clot, or we put a catheter in there and blow the clot up against the wall. And then we put in a stent. It looks like a Chinese finger trap. And that keeps the artery open, and we've saved so many lives now. It's really amazing. And you need to stay with your doctors about this kind of stuff. See your doctors on a regular basis, because we need to check things like your cholesterol. If your cholesterol is bad, there's much more of a chance you're going to have a heart attack. If your diabetes is out of control, there's much more chance you're going to have a heart attack. So stick with your doctors and see your doctor regularly the older you get. There are some fascinating things that I've seen with people that are having heart attacks, and I'll give you one story which was really quite interesting. I had a married couple that were about 45 or 50 years old, and they told me the gentleman said he'd been having intercourse with his wife and he finished. By the way, 4% of heart attacks occur when you're having intercourse. The next thing that happened is he rolled off of his wife and he felt pain between his shoulder blades, which is one of the atypical things that you can have with a heart attack. He thought he had strained his back, and it made sense, but we weren't sure, so we did an EKG that looked good, and we started ordering some blood tests, and before anything came back, he had a seizure, so we knew that that was a heart attack. We were able to run over with the defibrillators and bang, get him back and save him, and we got him admitted to the hospital, and he did fine. But that's the typical story of somebody that came in with a story with pain in the back. I had other things happen that were pretty interesting. One time I was taking care of, if you can believe this, a 24-year-old young man. And he had come in for a finger laceration. He had cut his finger, and I sewed him up. And I was working on his paperwork to discharge him. And the nurse came back to me and said, "He's having chest pain, Dr. Agron." Well, I assumed it was probably nothing. But what do? You've got to get an EKG. So we got an EKG, and sure enough, that kid was having a heart attack. Almost unbelievable. So, when we have chest pain, we have to take it seriously, the young and the old. It's more often going to happen in an elderly person, but you just can't take things for granted. Had another guy with a hereditary problem. He was 49 years old, and he used to kind of brag and say, "Nobody in their family has made it to 50, nobody." And I'm doing fine. I'm 49 years old. He called me up from Las Vegas. I was down in Los Angeles, and he said, "I'm having this chest pain." He said, "You need to get to the emergency room right now." Well, he didn't do that. He did seem to do okay, and he came down to Los Angeles, and he went to an urgent visit clinic, and he called me up. So they say, I'm fine. I'm not having any more chest pain. The next thing I heard, he had died. So you have to take this stuff seriously. You have to go to the emergency room, let them get an EKG, and let them do blood work to make sure everything's okay. This is such a serious problem. Okay, I want to explain something to you. You're hearing some funny sounds in the background. That are the sounds of peacocks. And I collect animals. I live on a small ranch, and I am kind of a rescuer. I have a rescue camel, I have rescue llamas and alpacas, I have a rescue miniature horse, I have some miniature pig, peacocks, pheasants, and plenty of other animals too. And you will hear noise like that from time to time. That's just what happens when you live on a ranch. So I think it's time for a joke of the day, because we've talked about some things that are serious and so forth, but this is one that I thought was cute, and it's a blonde joke. I'm going to tell you that ahead of time. And I've heard an awful lot of blonde jokes before, and most of them I think are a little bit on the silly side, but this one I thought was cute. It was about a blind Marine who goes into a ladies' biker bar. And he sits down and says, "I'm going to have a whiskey. Who wants to hear a blonde joke?" So the lady, that's the bartender, says, "Well, I got a baseball bat back here, and I'm blonde. Are you sure you want to tell that joke? And I also want you to know that the lady that's full of tattoos, you can't tell, but she's full of tattoos over to your left. It's a lady wrestler, and she's blonde. And on your other side is a lady boxer who's blonde, and she's a pretty famous boxer. The lady behind you is blonde too, and she is a pretty rough character. Oh, by the way, the bouncer at the door is blonde. So that's 5 blonde people in here that have got a little muscle. Are you sure you want to tell that blonde joke? The old Marine thinks about it for a minute. He says, you know, nah, I don't think I will. I don't want to have to explain it 5 times. So I thought that was kind of a cute joke, and I thought I'd pass it on to you. One of the few blonde jokes that I thought was really humorous. So thank you very much for tuning in. Keep those cards coming. Keep those emails coming. Keep your suggestions coming. I want to hear your jokes. I want to hear your medical questions. I want to be your emergency room doctor. It doesn't cost you a dime. I'm happy to help the public. So you guys feel free to keep in touch with me. You've got my email address now. So please feel free, and we'll see you again for the next segment. And in the meantime, have a happy and healthy few days. See you later.